And speaking exclusively to Mirror now, Maharashtra Health Minister Rajesh Tope has admitted that the Mumbai metropolitan region, which is an extension of Mumbai, has poor health infrastructure and there is a need for immediate revamp. The minister also goes on to say that the region has been ignored for long. Laying out the measures that this government has taken, the minister has said that they are planning to ramp up the facilities, like adding 1,000 COVID beds with oxygen facility and 350 more ICU beds in this region. He also added that the Kalyan-Dombivali region will get its first corona testing lab in the next 2 to 3 days.
I've been joined by State Health Minister Mr. Rajesh Tope. Sir, my straight question to you, after 3 months of lockdown, still we are seeing almost 8 to 9 corporations adjacent to Mumbai, they are still facing the lockdown. Why it is happening, sir?
Actually, lockdowns are to be we have empowered all the local authorities to take the necessary steps regarding lockdown issue, because suppose if numbers gets on increasing and if the infrastructure facilities like availability of beds and all becomes hand to mouth, in that situation we have to control it by a small lockdown to ensure that the chain is broken, and then again in the meanwhile also we can ramp up the facilities of the beds which are in that area, so that in the further period, even if the number increases, then that can be taken care of.
But sir, somewhere you also accept that there is a lack of infrastructure in this MMR region, especially if we talk about Thane or Kalyan Dombivli or Bhiwandi or Navi Mumbai, Panvel also.
Yes, absolutely. There is a shortage of ICU beds. I am specifically talking about. Thane city actually has always been taken care by, but the other than the considering the whole of the district Thane, if we see, there are many small Mahanagarpalikas and Nagarpalikas like KDMC, then even Bhiwandi, Ulhasnagar, Ambernath, and Badlapur and all. So these the health infrastructure has in the past has not been taken care. So there a specific infectious hospital or a multi-speciality hospital has to be built up in the near future. That I have always been speaking to even the Honorable CM and even in the cabinet, that this area in the area which just I mentioned actually have a speciality hospital. Also till then we are planning up with at least 1,000 bedded oxygen beds and approximately 350 ICU beds. So this type of hospital, which are called as jumbo hospitals, will be coming into that will be we are planning to have it completed within a span of a month. So that has been taken in our hands, and we are continuously building up this beds of oxygen and ICU.
But there is an allegation against your government saying that you only concentrated on Mumbai and you gave a step-motherly treatment to MMR region, especially the Thane, from where most of the people come to the Mumbai for work.
Actually, it is nothing like that. The whole of the Maharashtra is to be taken care. It's never a stepmotherly attitude which the government has ever shown to any of the place, not even to MMR region or the Thane region, any of the place. So wherever, suppose there I accept the cases are increasing, and as I told you, just in the small, because there the population is very dense and health facilities should have been taken care in the previous government also, but unfortunately that has not been taken care. So at present we are giving full focus to increase the beds, ICU beds, oxygen beds, and the overall healthcare facilities we are taking care of. The lockdowns which we have imposed at present, I have also instructed the commissioner over there, like for KDMC, Suryavanshi, then even for Bhiwandi and all, that the lockdown should be seen very properly, and it should be ensured that the spread should not occur. So for that, the public should not be on the road, and if suppose for some essential services they are coming out, they should maintain the social distance.
So, but if we talk about KDMC, it's a big corporation. If we talk about the population-wise, there's sizable amount of population, and that population travels to Mumbai and other parts of Mumbai for the work. But right now, also there is not a single testing lab. So what usually happens that they get tested or their swab sample they collect it and they send it either to Mumbai or to somewhere other to some other place, including Thane. So this is causing delay and there is a lag. So why there is no lab which the state government or the local corporation with the help of state government constructed in last 3 months when the numbers were increasing?
You see, the numbers went on increasing in last 1.5 months actually, really speaking, because when we unlocked the state on 3rd of June, so from that day onwards, the MMR region people, they started coming to Mumbai, and so that because of that also the numbers increased over there, because Mumbai at that point of time was quite infected, and hence now because of that reason, there the numbers are increasing at present. But as you said that regarding the testing,
Yes.
KDMC, I have announced that government of Maharashtra Health Department, and with the help of the DPDC as well as the SDRF fund, collector has also told lot many times that they will be coming up with 5 new labs for testing. So KDMC will be coming up within 3 to 4 days. The proposal has been sent to NABL and ICMR for the final approval. The machines has been ordered, the construction and the totally is finished. So it will be made operational within 2 to 3 days maximum.
Okay.
And so henceforth the KDMC and the nearby small D class municipal corporations at present are dependent on Mumbai or Thane. They will not have to be dependent henceforth once the testing lab starts. And just I want to mention that yes, when this corona COVID-19 is, as everyone knows, that it's a very new, very contagious disease, but since the inception, like 9th of March when first patient was seen, since then there was only one lab. Now there are more than 110 labs. So government of Maharashtra has always been very much instrumental in increasing the number of labs and increasing the testings, which is the protocol mentioned by ICMR.
The last question I'd like to ask you, as you said about the KDMC, you already had word with the KDMC Commissioner, Mr. Suryavanshi, but the Mirror Now team is on the ground, and since morning we are reporting people are not following the social distancing, people are not following the containment policy rules. They are coming on the roads in a large number to purchase the fruits or vegetables or the essentials, but now also there are vendors who are openly selling the vegetables post that particular time which was given. So in this regard, what you have suggested, what you have asked Mr. Suryavanshi, who is a KDMC commissioner, to follow and to do?
Just now I spoke to KDMC Commissioner Mr. Suryavanshi. He will also ensure, because he is the real nodal officer taking care of all these issues of lockdowns and all, but strict perimeter control which is to be enforced by the police department, we will also ensure. I will also speak to the SP Thane in this regard, that perimeter control in the containment zone as well as in the total lockdown area needs to be ascertained, and unwanted public coming out just for the sake of fun, I think they should not be allowed, and only essential services should only be allowed, nothing other than that. So police control is required, and also Commissioner KDMC also will be properly instructed to take the necessary corrective steps.
That's what we heard from Mr. Rajesh Tope, who was telling us that what exactly plan he has got for the KDMC, and within next 3 to 4 days, a testing lab will start its operation in KDMC itself. With camera person Sahil Suresh, Mayuresh Kandwate for Mirror Now.